Judy Hess was one of the first faces you would see when you walked into the cancer center. But in 2018, she suddenly found herself going from employee to patient. A picture is worth 1,000 words, and in Judy Hess's case, 1,000 pre-cancer memories, like this one of a family vacation in August 2018. Just days later,
I was going about my normal business and looked down and discovered that the nipple on my left breast was turning in. And it scared me. So I called my family doctor, and she saw me immediately, sent me for a mammogram.
Judy knew the process well. As a front desk employee at Penn State Health St. Joseph Cancer Center, she had prepared countless other women for what comes next.
It's a very unique process for breast cancer as opposed to even other cancers because it's so personal, and there's so much emotion tied to it. So it's nice to be able to spend the time and go through and find what's right for these patients.
Things happened very, very quickly. I met with Dr. Aboud, the surgeon, and clarified what type of surgery we were going to do, and I opted for the double mastectomy.
During surgery, doctors found previously undetected cancer in her right breast.
I was shocked. I mean, we thought it was contained only in the left breast, and after the surgery, he said that I was good that I opted for that because there were some markers or cancerous spots in the right breast. And I knew down deep that I had made the right decision because I didn't want to have to deal a few years down the road, have to deal with another mastectomy. So I was convinced that that was the right thing for me.
So Judy was a little different. So Judy had a more advanced breast cancer, and she opted for a mastectomy. And the general thought process is a lot of times that if you get a mastectomy, all the cancer is gone and you don't need radiation therapy afterwards. But based on Judy's cancer characteristics, based on the size, and based on the way it actually involved her breast and surrounding tissues and lymph nodes, she was a candidate based on national guidelines for radiation therapy as well. So she had chemotherapy after her surgery, and then she had radiation therapy to her chest wall, which is basically, the breast is not there anymore, but we're still treating the area where it has the most risk for it coming back. And also the lymph nodes, which include the lymph nodes under the arm and the lymph nodes in the neck region over here.
Through the mastectomy, they had gotten all the cancer. So I was cancer-free, thank God. And with that dictated type of chemo I was to have. So this was all precautionary going into chemo, just be safe.
Treatment meant a role reversal for Judy. She was now a patient where she'd spent years working.
The nurses that work with the doctors are, again, just the sweetest, kindest, caring people. I think that in that environment, the people that work there are really special people. They have the biggest hearts and so caring, and will open their arms to you and give you anything that they can do to help you.
Judy is now retired, but only took 1 week off before returning to the cancer center, this time as a volunteer in the infusion center.
Just her presence, just her being able to make her colleagues, in the workplace aware of the importance of self-exam mammograms, but also keeping a positive attitude to the whole thing. Having gone through an advanced cancer that needed not just surgery, not just chemotherapy, but also radiation therapy and the whole slew of treatments, she's maintained a positive attitude throughout that. She has been able to bring that positive attitude to work. And now as a volunteer and also, working per diem in the front desk, I think she just brings a different perspective to her role as what she's doing, but also to her colleagues. And I think she serves an inspiration to all of us when she does, what she does with such a big smile on her face.
Everyone in the office had been so kind and caring for me. I wanted to give back. And I thought I could volunteer and give help in any way I could.
Judy remains cancer-free, but she will continue to get scans.